Can deep brain stimulation lead to neuronal damage? Insights into its impact on Parkinson's treatment. Today, we're taking an in-depth look at a recent study on deep brain stimulation, or DBS, a well-established but complex therapy for Parkinson's patients. Parkinson's disease is a progressive neurological condition that affects movement, causing tremors, stiffness, and slowed motion over time. DBS has been used effectively to manage these symptoms, particularly in cases where medication alone is no longer sufficient. DBS involves surgically implanting electrodes in specific areas of the brain, most commonly the subthalamic nucleus, STN, a region that plays a critical role in movement control. These electrodes are connected to a small device implanted in the chest, which sends continuous electrical pulses to help normalize the brain's activity. By stimulating these areas, DBS can reduce symptoms like tremors, rigidity, and involuntary movements, enabling many Parkinson's patients to regain a degree of motor function and improve their quality of life. DBS is unique because, unlike treatments that alter the brain's chemical balance, it uses electrical currents to influence brain function directly. It's essentially a pacemaker for the brain, with adjustable settings that allow doctors to fine-tune its effects. However, DBS has long raised an important question. Does the procedure itself, or the long-term electrical stimulation, cause any form of brain damage? The study we're discussing set out to answer this question by using a biomarker called neurofilament light chain, or NFL. NFL is a structural protein found only in neurons, brain cells, and it's released into the bloodstream when neurons are damaged. By measuring NFL levels in patients' blood before and after DBS surgery, researchers could track any neuronal damage that might occur due to the surgery or the ongoing stimulation. Using NFL as a biomarker is advantageous because it offers a non-invasive way to monitor brain health over time. Higher NFL levels in the blood have been linked to various neurological disorders, where it indicates active or recent neuronal injury. In Parkinson's disease, NFL levels tend to be higher as the disease progresses, though they remain lower than in faster progressing neurodegenerative conditions like multiple system atrophy. The study monitored 92 patients with DBS and 57 patients receiving the best available medical treatment for Parkinson's. Researchers found a noticeable increase in NFL levels shortly after DBS surgery. This was most evident within the first few days and weeks after the procedure, suggesting that the surgical insertion of electrodes itself can lead to temporary neuronal damage. Such increases in NFL are common in cases of brain surgery or injury, where even minor trauma can release NFL into the bloodstream. But here's the critical part. After the initial post-surgery period, when the electrical stimulation began, NFL levels returned to baseline. This was true for both the start of DBS stimulation and for long-term DBS patients who had been receiving stimulation for years. This pattern implies that while the physical act of surgery may cause short-term neuronal stress, the ongoing electrical stimulation does not contribute to further neuronal damage. This finding is significant because it supports the safety of the stimulation phase of DBS. While surgery itself involves risks, the electrical impulses used in DBS don't appear to harm neurons in the long term. This finding was consistent across various time points and in patients with different disease durations. These findings provide valuable insights for both doctors and patients. For patients, it means that DBS is a generally safe treatment option, and the stimulation process does not seem to cause ongoing brain damage. However, understanding the short-term effects of the surgery is important, especially when it comes to selecting suitable candidates for DBS. For example, patients who are older or have cognitive impairments might need to be considered more cautiously, as they could be more vulnerable to potential post-operative complications. For doctors, these insights reinforce current practices that recommend careful patient evaluation before DBS. Given that the initial surgery causes temporary neuronal stress, it's particularly important to weigh the risks for patients with advanced age, dementia, or other vulnerabilities. This could involve using NFL or similar biomarkers in pre-surgery assessments to better predict which patients might experience higher post-operative NFL spikes. While this study provides valuable insights, it also has some limitations. The research was conducted at a single center, which means the findings could be influenced by the specific methods used at this hospital. Additionally, only NFL was used to measure neuronal damage, and a larger, multi-center study might offer a more comprehensive understanding of DBS's effects. More research is also needed to identify potential predictors of NFL spikes in response to surgery, which could help refine patient selection and enhance safety. In summary, this study provides reassuring news for Parkinson's patients considering DBS. The temporary increase in NFL following surgery reflects typical neuronal stress that occurs with any brain intervention, while the stimulation itself is safe and does not lead to neuronal damage. For many patients, DBS remains an effective and life-changing option for managing Parkinson's symptoms. Looking ahead, we hope to see larger studies that can expand on these findings and improve our understanding of how DBS affects the brain. With more research, doctors may be able to tailor DBS even more precisely, ensuring that this powerful therapy continues to improve lives without compromising brain health.